Psoriatic arthritis is a type of inflammatory arthritis that affects some people with psoriasis, which is a condition that causes the rapid buildup of skin cells. It's considered an autoimmune disease, which means your body's immune system mistakenly attacks healthy tissue. People with psoriatic arthritis experience both skin and joint problems. After watching this video, make sure you check out the first link in the description to get our recommended arthritis natural cure. Symptoms may vary, depending on the case. Usually, skin issues develop first, and the arthritis comes later. But joint problems can occasionally crop up without signs of psoriasis. Psoriatic arthritis can cause a broad range of symptoms. Not everyone with the disease experiences the same problems, and some people have issues that are more severe than others. Symptoms may include stiff, painful joints, redness, heat, or swelling in the tissues surrounding the joints, red skin with silvery white, scaly patches, itching or burning of the skin, nails that crumble, become pitted, or lift from the nail beds, sausage-like, fingers or toes, hand deformities, foot, neck, or spine pain, trouble bending and reduced range of motion, inflammation of the eyes, which can cause irritation and vision problems, fatigue. Doctors aren't exactly sure what causes psoriatic arthritis, but they do know it happens when your body's immune system starts to attack healthy tissue. This faulty process causes an overproduction of skin cells and inflammation in your joints. Experts believe that both genetic and environmental influences may be to blame for the immune system failure. Certain factors that may increase your risk include having psoriasis. Being diagnosed with psoriasis is the greatest risk factor for developing psoriatic arthritis. Family history. About 40% of people with psoriatic arthritis have a family member with psoriasis or arthritis. An infection. Having a viral or bacterial infection may activate the immune system and trigger psoriatic arthritis in some people. Age. Anyone can develop psoriatic arthritis, but it's more common in those between ages 30 and 50. Obesity. Being overweight puts more wear and tear on tendons, which may cause inflammation and trigger psoriatic arthritis. Here are the 5 different types of psoriatic arthritis. 1. Symmetric psoriatic arthritis. As its name implies, this type affects joints on both sides of your body at the same time. About half of people with psoriatic arthritis have the symmetric kind. 2. Asymmetric psoriatic arthritis. With the asymmetric type, problems don't develop in the same joints on both sides of the body. It occurs in about 35% of people with the disease and often causes more mild symptoms. 3. Spondylitis. This form of psoriatic arthritis is characterized by pain and stiffness in the neck and spine. 4. Arthritis mutilans. People with arthritis mutilans experience deformities in the small joints at the ends of the fingers and toes. This type is considered the most severe form of psoriatic arthritis. But it only affects about 5% of people with the condition. 5. Distal psoriatic arthritis. It causes inflammation and stiffness near the ends of the fingers and toes, while also affecting the nails. To diagnose psoriatic arthritis, your doctor will probably first perform a physical exam to look for swollen joints, skin or nail changes, eye problems, and joint tenderness. You may be asked to undergo an X-ray, MRI, ultrasound, or CT scan, so your physician can get a better look at your joints. Additionally, you might need to have a blood test to rule out other related conditions, such as rheumatoid arthritis, gout, and osteoarthritis. Some doctors will perform a test to analyze a sample of fluid in your joints. Occasionally, a skin biopsy is also required to confirm a psoriasis diagnosis. Psoriatic arthritis is considered a chronic disease. Symptoms typically worsen over time, but you might experience periods of improvement or remission. Often, these improvements are interrupted by episodes of intensified symptoms, known as flares. Flares may come and go. Some people experience frequent flares, while others rarely have them. Identifying what prompts your flares can help you avoid the triggers. Common culprits include stress, skipping medications, certain foods, and illness or injury, and lack of sleep. Some therapies for treating psoriatic arthritis include nonsteroidal anti-inflammatory drugs, NSAIDs. NSAIDs, such as ibuprofen, Advil, Motrin, and naproxen, Aleve, can help reduce inflammation and pain. While these medicines are available over the counter, OTC, your doctor may be able to write you a prescription for a stronger version. Disease-modifying antirheumatic drugs, DMARDs. DMARDs are often recommended if your condition doesn't improve with NSAIDs. They can help slow the progression of the disease and prevent permanent joint damage. DMARDs include methotrexate, Trexall, sulfasalazine, azulfidine, and leflunomide, Arava. TNF-alpha inhibitors. These drugs help block an inflammatory substance in your body called tumor necrosis factor, TNF. They can lessen pain and improve swollen joints. Common TNF-alpha inhibitors include etanercept, Enbrel, adalimumab, Humira. Infliximab, Remicade, certolizumab, Cimzia, and golimumab, Simponi. Immunosuppressants. These work by targeting the immune system. Examples are cyclosporin, Gangraf, Neoral, Sandimmune, and azathioprine, Imurin, Azasin. Steroids can help reduce inflammation quickly. They can be given orally or are sometimes injected right into the problematic joint. Apremilast, Otezla. This drug works inside inflammatory cells to reduce the activity of an enzyme called phosphodiesterase 4, PDE4, in your body. It helps reduce swelling and pain. Newer medicines may help improve symptoms of psoriatic arthritis. Some include apremilast, Otezla, secukinumab, Cosentyx, abatacept, Orencia, ixekizumab, Taltz, and ustekinumab, Stelara. Topicals treatments applied directly to the skin can ease scaly, itchy rashes caused by psoriasis. These therapies come in creams, lotions, shampoos, gels, sprays, or ointments. Right now there's no surefire way to prevent psoriatic arthritis. But research does suggest that people with the condition who seek treatment within 6 months may develop less damage and experience fewer long-term problems. If left untreated, psoriatic arthritis can cause joint damage and disability. Sometimes, the condition leads to complications, such as high blood pressure, high cholesterol, obesity, diabetes, heart disease, deformities of the hands, feet, or spine, eye issues, such as uveitis or conjunctivitis, osteopenia or osteoporosis, gastrointestinal problems, lung disease, liver disease, gout, cancers, especially lymphoma and non-melanoma skin cancer, depression. In addition to psoriasis, psoriatic arthritis is associated with a long list of other diseases. Symptoms of psoriatic arthritis are similar to those of rheumatoid arthritis, gout, and Reiter's syndrome, a rare disorder characterized by arthritis and inflammation in certain areas of the body. Psoriatic arthritis is also closely linked to inflammatory bowel disease, especially Crohn's disease. In fact, research has shown that people with psoriatic arthritis and Crohn's share similar genetic mutations. In a study of women with psoriasis, about 10% developed an inflammatory bowel disease. This association was even greater in those with psoriatic arthritis. Remember to get our recommended arthritis natural cure in the first link in the description box.